I've helped a lot of people recover from lateral elbow pain in my practice, and today I'm going to help you. And no, the treatment is not push-ups. In this video, you'll learn everything you need to know about lateral elbow pain, lateral epicondylitis, tennis elbow, or lateral elbow tendonitis, including what causes it, what to do to fix it, and how long it takes to get back to 100. We'll also reveal the secret sauce most people have never heard about for unlocking your recovery, though it's not really a secret anymore. Thanks to Real Land for sponsoring this video. More information about their amazing protein later in this video. All this information is for educational purposes only. None of it should be taken as medical advice or as a replacement for seeing a qualified professional. Certain injuries such as ligament tears, elbow dislocations, snapping elbow syndrome, and bone fractures will not be covered here. Proceed at your own risk. To get rid of lateral elbow pain, it helps to know the symptoms and why they occur. There are two causes you need to know: tendon pathologies and nerve compression or impingement. A tendon pathology is the one most people are aware of, which is where a tendon is inflamed and painful due to a chronic buildup of damage, commonly referred to as tendonitis, tendinopathy, or simply an overuse injury. This type of injury happens when the tendons can't recover fast enough from the micro trauma it encounters during intense, repetitive activities like climbing or tennis, meaning the micro trauma accumulates until it's not so micro. This leads to diffuse discomfort, a dull ache, which may be localized or spread out, or even a sharp or stabbing sensation. In this case, there are actually 7 different tendons that could be the culprit. The muscles these tendons attach to are as follows: extensor carpi radialis brevis, or ECRB, extensor carpi ulnaris, or ECU, extensor digitorum, or ED, extensor digitorum minimi, or EDM, the supinator, the extensor carpi radialis longus, or ECRL, and the brachioradialis. Those first 4 actually originate from the common extensor tendon on the lateral epicondyle, branching off into different wrist and finger extensor muscles. The other 3 have separate origins. Now that you've got a better idea of the muscles and tendons involved, you may be starting to realize why push-ups are not the way to cure them. But first, let's talk about the second cause. The highly underrated cause of lateral elbow pain is nerve compression, also known as nerve entrapment or impingement. This is the one that gets overlooked by so many people, leading to a frustrating recovery experience. Why is it so overlooked? Because most people think nerve symptoms can only be a tingling or burning sensation. Yeah, this hurts really bad, but it's not tingling or burning, so can't be a nerve. But that's just not actually true. The real symptoms of nerve compression are diffuse discomfort, a dull ache, which may be localized or spread out, a sharp or stabbing sensation, or a numbness or tingling or burning sensation. Sound familiar? Turns out nerve symptoms in the elbow can mimic the symptoms of a tendon pathology. So if you have any of those overlapping symptoms, you shouldn't immediately assume it's a tendon issue. For nerve-related issues in the lateral elbow, the radial nerve is the culprit. Compression of the radial nerve at the elbow is often called radial tunnel syndrome, or RTS. However, since the radial nerve passes through, under, and between various muscles in our arms, it can get pinched by a lot of different structures, and sometimes your elbow pain can be caused by impingement in a completely different area. Now, with so much overlap between tendon and nerve symptoms, how can you tell which one is actually causing your elbow pain? This can be quite tricky to figure out because the activities that provoke your symptoms could be irritating either the tendon or the nerve, or both. For example, when you yank on a crimp or swing a tennis racket, you're putting load on those elbow tendons, but the muscle contraction can also squeeze the nerve. However, there are a few useful differentiators to look out for. Numbness and tingling are symptoms only associated with nerve compression. If you experience this as your primary symptom, it is a nerve. If you have numbness or tingling along with other symptoms like a dull ache, you might have a combination of nerve and tendon involvement, or you might simply have varying levels of nerve compression at different times. For example, you might sometimes have mild compression that causes a dull ache, and other times have more significant compression that causes the numbness or tingling. So, combination symptoms could be tendon and nerve, or just nerve. If your symptoms change with the nerve mobilizations, or the stretches I'll be showing you for the chest or shoulder, a nerve is involved. If your symptoms are constantly provoked when your elbow is bent, such as holding your phone for too long, a nerve is also likely involved. If you're positive that your symptoms are only nerve-related, then you should watch our video, How to Fix Nerve Tension for Climbers, instead of this one. If you think your symptoms are related to neither tendons nor nerves, such as radial head dislocation, fracture, ligament sprain, osteochondral dissecans, arthritis, or any other ligament or bone issue, this video is unfortunately not for you. For everyone else, I recommend you complete the full routine we're about to lay out, even if you're dubious about nerve involvement. Since it is possible for lateral elbow pain to be caused by both a tendon and a nerve issue, the secret to solving the issue for many people turns out to be treating both the tendon and the nerve at the same time. Since nerve issues are constantly missed by even professionals, it's worth performing the nerve exercises for at least a couple weeks. You might actually be pretty surprised by the results. I'm sure people out there are just as skeptical as I was that vegan protein could actually taste good, so we decided to give some away for free.
I actually like it.
It's way smoother than typical vegan protein powders.
I didn't get an aftertaste of stevia.
It's not sickly sweet.
Not too sweet, but like sweet enough.
I like that it's not too sweet.
I think this is really good.
I love the ingredients.
I would definitely buy this.
Use that code HoopersBeta at checkout for 25% off your entire Real Land order. How do I recover? Before you begin this protocol, you should have a bit of context. Because there are multiple structures that can cause symptoms at the elbow, the exact recovery exercises needed can vary from one person to the next. That means a few things. For the best chance of success, this program will take a broad, cover all the bases approach. If what we lay out here is too hard for your current stage of recovery, you'll need to regress the difficulty to the appropriate level on your own. Of course, if you don't want to deal with that, remember you can always use one of our pre-made recovery blueprints to make it super easy. This is not a personalized program, so you may find there are exercises here that you don't need, but that may be extremely beneficial for somebody else. You will need access to some tools, namely dumbbells or a kibble machine, and a lever bar or a hammer, or better yet, one of our Torque Pro devices. Number 1, reducing aggravating factors. Before you add recovery exercises, you first need to reduce aggravating factors, which are things that make your symptoms worse. Since one of the common causes of elbow pain is too much work being asked to the specific tendons, you shouldn't expect to recover if you keep piling on the exact same work. This does not mean you should stop all activity, but you need to cut back on the aggravating factors based on the severity of your symptoms. In general, if the pain from activity does not exceed 2 out of 10 during and 24 hours after you do it, that activity is likely fine. If an activity causes more or longer lasting pain than that, you'll likely need to reduce the intensity, reduce the volume, or change the movement style to bring the pain down to the acceptable level. Number 2, soft tissue mobilization or STM, or instrument-assisted soft tissue mobilization or IASTM. STM and IASTM are both forms of massage therapy, which is a low-cost method that could have a positive impact on your healing. It's not a guarantee, but it's thought to improve the alignment of new tissue, increase blood flow to the area, and increase neurological awareness of the area. Note, it is optional here. If you find that it irritates or worsens your symptoms, it might be because the painful structure you're trying to massage is actually your nerve, and it might not like that. So if this type of massage makes things worse or does nothing for you, discontinue it. Next, let's get into a few different stretches. Unlike the optional massaging, I do recommend you perform these stretches even if you don't notice an immediate change in your symptoms. It may take a couple of weeks for the benefits to show up. Up first is a 3-way wrist extensor stretch. The purpose of this stretch is to loosen up 5 out of the 7 target muscles of the lateral elbow pain, the ECRB, ECRL, ECU, ED, and EDM. So it's quite efficient. First, start with your hand just in a gentle fist. Grab with the other, and then you're going to pull it down into flexion to stretch the extensors as you straighten your elbow. Now the 3-way part comes from pulling straight down as 1, pulling across as 2, or in as 3. Now when you do these different positions, it's totally fine to let it kind of like rotate and play with that position some to find like the good stretch that you're looking for, usually up into the forearm region. Now, the hand position here makes a difference too. If you're in a super tight fist, as you go down, you're probably just gonna be stretching the finger extensor muscles. So I don't recommend like a super tight fist. And I also don't necessarily recommend it just being super loose. If you find the right stretch that way with the hand like completely loose, then that's fine. But generally adding a little bit in will get a little bit better of a stretch and include more structures in that stretch, which is beneficial. If when you're pulling in and you only feel like pulling or compression at the joint space, then I would try and make a slightly tighter fist. If doing that still doesn't correct it and you only feel like a pinching sensation in your wrist, then I probably wouldn't perform this stretch. If you feel one variation is more effective than another, it is okay to focus on those. Up next will be 2 pec stretches, one with the arm at 90 degrees and the other at about 120 degrees to get more pec minor involvement. These 2 stretches are important because lateral elbow pain can actually stem from nerve compression in the chest or shoulder region. Performing pec stretches can mobilize these areas and help alleviate this compression, leading to reduced discomfort. For the pec 90, simply put your arm in a 90-degree angle, so 90-degree elbow, 90-degree shoulder, and then take a step forward until you start to feel a stretch in the shoulder or chest region. Now, this staggered stance is really appropriate. You don't want to just be holding yourself up, and that staggered stance will allow you to adjust the intensity by kind of driving through your back leg. To also adjust the stretch itself, you can rotate the body away from the target side or even bring your chest down or a combination thereof. And again, you might find this stretching along your chest or in front of the shoulder a little bit. Either location is fine, as long as it's not causing pain there. Many of the same aspects hold true for the pec 120. Your arm is just going to be slightly higher up, so it's at about a 120-degree angle. Make sure your elbow is still bent some. You don't want it fully straight. You might be getting more of a median nerve stretch or a bicep stretch if you do that. So keep the elbow slightly bent. Once again, step forward to drive that stretch, and then play with the rotation or the lean to find the right stretch. That's a good spot there for you. And this one, again, could be in the chest region or slightly in front of the shoulder, but both locations will serve you well. These stretches should not be painful. Apply only enough force to generate a mild stretch. While a small amount of discomfort, like 1 or 2 out of 10, may be experienced, it should never truly feel painful. If you do start to feel pain, reduce the stretch intensity by reducing the range of motion or the amount of force you're using. Also, if you do feel any numbness in your hand with a sustained pec stretch, simply get out of that stretch and then let the sensation restore before you repeat. Let's now get into some isolated nerve mobilizations. There are 2 primary techniques, nerve flossing, which is the gentlest form, and nerve tensioning, which is the most aggressive form. In my experience, the radial nerve appears to be pretty tolerant to slightly more aggressive techniques, so to be ultra efficient, we'll focus on the nerve floss plus tension hybrid technique. If you find this hybrid technique to be too aggressive, you should regress to nerve flossing techniques, which we'll provide instructions for in the show notes, link in the description. All right, now this one's a little bit tricky because there's a lot of little nuance to the positions that you can get in with this. So ultimately it's going to look like this, but the nuance we want to get into, I'm going to focus on one arm at a time, so it's not so much. So we are going to have our arm, like basically in the finished position of a bicep curl, as our starting position, and on the finish, it's going to rotate down, the elbow is going to straighten, and our arm is going to continue to rotate out as we flex the hand up. So you'll notice there's a lot of different finishing components here. Elbow is straight, wrist is flexed, arm is even slightly rotated out, and while you're maintaining this down shoulder position. Now, I do feel a little stretch here. That is the radial nerve that I'm feeling. And we want to make sure that we play with that position too, because sometimes if you're here, you may not feel much. And if you rotate it out, you're like, oh, there it is. Or a common thing I see with people is they don't actually fully straighten the elbow. So you do want to make sure that that is as straight as it can be in order to feel that stretch. Now, obviously, if that's way too much stretch, then let the elbow bend some. So now that we have those little nuances pointed out, if we combine this into the actual technique, you start with both arms in, and then both arms go down, rotate out, and then you look towards one side. So right now I'm flossing my right side and tensioning my left. I come back up, and I do the opposite. So right now I am tensioning my right and flossing my left. And then I just repeat these. So tensioning left, flossing right, tensioning right, flossing left. And remember, you can play with all sorts of positions on this. Elbows fully straight or slightly bent, shoulders further depressed or slightly up, all that to help manage the amount of stretch or intensity that you're looking for. With nerve floss plus tension techniques, there should be a gentle stretch in one arm at a time, but it should not cause pain or discomfort. Some symptoms may temporarily increase for up to a few minutes, but should not last longer than that. If you feel pain or discomfort, check your form. If you believe you are doing this correctly and still experience an excessive increase in symptoms, try reducing the range of motion to reduce the intensity. If that doesn't work, discontinue this activity and consider seeking out more in-depth management of this issue with a qualified healthcare provider. Finally, we'll get to some of the off-the-wall tissue strengthening. You might be asking, why are you telling us to add these exercises when earlier you said a primary cause of this is doing too much work? Great question. Reducing aggravating factors and unpredictable loads with specific recovery exercises gives you a controlled environment to better understand your symptoms and how they respond to certain exercises. Tissues heal better with controlled, specific loading protocols, which we can accomplish with these off-the-wall exercises. For lateral elbow pain, there are 4 primary exercises and 1 bonus. Number 1, wrist extension with elbow bent. Number 2, wrist extension with elbow straight. Number 3, hammer curls. Number 4, forearm supination, and the bonus, flat bar reverse curls. We've presented these exercises in order from most to least likely to be effective in lateral elbow pain recovery. Before you make any decisions about which ones you should do, I recommend you try all of them on both your injured and uninjured side to get a comparison. This lets you see if any of the exercises feel like they target your symptoms way more effectively than the others, or if you feel way weaker with some exercises than others compared to your uninjured side. Once you do that, follow these guidelines to create your tissue loading program. Number 1, if some of the tissue loading exercises do end up feeling far more effective than others or significantly impaired compared to your uninjured side, it's okay to focus on those exercises and not do the other ones. 2, if number 1 does not apply to you and you want the most efficient program possible, perform only forearm supination and flat bar reverse curls. Number 3, if you're feeling uncertain or just want to do the most comprehensive protocol possible, perform all 4 of the primary exercises. Just remember that you need to avoid adding in too much extra load all at once, so you may need to start with lower volume, fewer sets, or reduced frequency, or both. Basically, just start out easy and increase gradually. With all that in mind, let's go ahead and demonstrate the exercises, and then we'll discuss some final notes. By the way, I'm going to demonstrate these exercises with the devices that I think are best, but you can feel free to use whatever equipment is available to you. Exercise 1, wrist extension with the elbow bent. Wrist extension with a bent elbow helps work the ECRB and ECU. The ECRB is the most commonly irritated tendon in the lateral elbow, hence why this exercise is number 1. It also is extremely useful in all grip sports as it serves as a counterbalance to the force generated by our wrist and finger flexors. I'm going to use a bench that can go up to an incline because then it just gives me a nice padded surface to use. And I'm going to use a thumb over grip because that's going to help balance the load between the extensor carpi radialis longus brevis and the extensor carpi ulnaris. Now, any range of motion that works for you is great. If you can go through a nice full range of motion, go for it. You might also notice there are like subtle things that you can change, like you might have some catching or clunking, then like a smaller range of motion is okay. Or if you grab like the device slightly more towards one side, it might change the way that things are loading for you and work slightly better. So it's okay to play with those small variations. But if you can, go through a nice, large, full range of motion. The tendon especially likes that for this recovery, so try and get through the full range if you can. Exercise 2, wrist extension with elbow straight. Wrist extension with a straight elbow now shifts the bias to the ECRL, which helps with extended elbow activities like reaching overhead. It's going to be pretty much the same setup for the bent elbow, obviously, except now we're going to move till the elbow is fully straight. Now, this might feel slightly different because you are going to get the extensor carpi radialis longus more than the brevis here, but that's the actual intention. So we make sure that we work that different muscle. So same thing here. If you can go through a nice full range of motion, then you should. But if not, it's okay to stop slightly shy of that full range. If you notice any kind of clunking, that's usually just a good indication that you might need this to improve some wrist stability. Exercise number 3, hammer curls. Hammer curls work the brachioradialis, which is a primary elbow flexor when the wrist is in a neutral position, not pronated or supinated. While you're performing it, just watch for additional compensations, like if you're swinging the weights to get it to work effectively. You want this to be an elbow-focused exercise, so you want it to be nice and controlled throughout the entire process. If you can't do that, you're probably just doing too much weight. Exercise number 4, forearm supination. Forearm supination specifically targets the supinator muscle, which attaches to the lateral epicondyle. In climbing, it helps stabilize the forearm and wrist while supinated, which is great for underclings. So again, the nice thing about this device is you have a nice even loading profile throughout the entire range of motion. So you get load on the supinator in the extended, the mid, and the fully flexed position. While doing this, if you notice massive compensations, like if you're like flexing up or like if you're flaring out a ton, you're probably using like your bicep a little bit more. You want it to be controlled with the arm closer to your side so you can get better work out of that supinator muscle. Like right now, I feel this firing up really nicely over here, so I'm definitely using my supinator, not just my bicep. And the bonus, flat bar reverse curls. Flat bar reverse curls place the forearm in a pronated position, meaning as you perform the curl, your wrist extensors are working hard. The pronated position shifts the bias away from the bicep brachii and toward the brachioradialis, brachialis, and ECU, while also stretching the supinator. The motion of going from straight to bent elbow also helps work both the ECRB and ECRL. Now this all sounds lovely, I know, and it's why it's a great all-purpose exercise for climbers and athletes alike to perform. But keep in mind that it does not isolate a single muscle, so it may be less effective at healing tendinopathies than the more targeted exercises we just covered. Grab any flat bar that you have available to you. Some gyms will have like the smaller ones that have like 10 or 15 pounds or 20 or 25. Great idea to start with lighter weight because this can be challenging. Simply grab it with a thumb over grip so the thumb is on the same side as the index fingers and slightly wider than shoulder width. Now you might need to adjust that position as you go as well because you might notice that your position will feel better or worse if you are wider or more narrow. So that feels too wide, that feels too narrow, whereas this feels nice and natural for my motion to go through. Now, if you feel like you're working really hard to just hold on to the bar, you can consider using some straps to help with that. Otherwise, just get you a nice workout for those finger flexors a little bit as well as you're doing all the extensors. If you don't have a flat bar, you can use dumbbells. It's just kind of impossible to keep it flat at the top. So it's still pretty effective, but I'm not trying to exaggerate and say it's impossible. Like I just literally can't like keep it perfectly flat as I get to the top of the motion. So it won't load the wrist extensor muscles quite as equally. It will get more to the radial side, which will be the extensor carpi radialis longus and brevis, and not as much the extensor carpi ulnaris. Since the ECRB and ECRL are more commonly involved than the ECU, it's still okay. Fine even, but it's just not as ideal because it won't load all of them. You can perform these exercises in whatever order you prefer, but here are a couple of my preferred methods. Method 1, if performing all exercises. Method number 2, if performing the minimum number of exercises. Between each superset round, you can take a short rest, or you can add in one of the tissue stretches or the radial nerve floss plus tension technique for efficiency. How much weight should I be using for all these exercises? With all the tissue loading exercises, you may have noticed the recommended intensity is typically 2 reps in reserve, or RIR. 2 RIR means you should be using as much weight as possible for each set while stopping 2 reps shy of failure. If you're not familiar with this concept, it may take a bit of practice to figure out what 2 reps shy of failure feels like. For our purposes, failure happens when your rep velocity significantly slows down, your form significantly degrades, or you experience more than 2 out of 10 pain during that set. So if you do experience any of those things, then you know you've gone too hard and need to reduce the weight or number of reps until you're further away from failure. If you're new to resistance training, I recommend starting at a very low intensity and working your way up to 2 RIR over the course of a few sessions as you get acquainted with the movements. How long will it take to recover? If it turns out it was just your nerves getting on your nerves the entire time, you should notice a quick improvement in symptoms within a few days to a few weeks. Though, keep in mind you might have to manage this long term, and some nerve symptoms can take much longer to fully resolve. If you notice an improvement with the radial nerve floss plus tension technique and the other stretches, keep doing them. If it's a regular tendon pathology, it can take 2 to 4 months to recover depending on how severe it was initially and how well you program your recovery. Remember, if you want to take the guesswork out of recovery, save yourself a whole lot of time, and get a program that's specifically designed for recovering from lateral elbow pain, which combines stretches, nerve mobility, and strength training all into one convenient routine on your phone, you can get that today on our website at hoopersbeta.com/recovery blueprint. These are the exact injury-specific programs I've used in my practice to help hundreds of climbers get back on the wall pain-free. They'll take you from the earliest stages of healing all the way to regaining full strength and returning to peak performance. Our recovery blueprints are a proven way to fast-track your recovery and get you climbing hard again. We don't just have elbow recovery blueprints either. If you've been dealing with finger or TFCC pain, we've got you covered, with more to come in the future. Alternative forms of treatment. If you're struggling with elbow pain that doesn't respond to load management, strength training, or nerve mobilizations, the first step will be to seek professional medical advice for individualized treatment. But here are a few other options that you should be aware of in no particular order. 1. Injections including cortisone, PRP, and prolotherapy, among others. 2. Extracorporeal shockwave therapy, which is a non-invasive treatment that delivers high-energy acoustic waves to the painful tendon area. 3. Dry needling, which involves inserting thin, sterile needles into specific myofascial trigger points or muscle knots in the tight forearm muscles. 4. Bracing, which can help if you're experiencing symptoms from your elbow being in certain positions while you sleep. 5. Ice, which can help some individuals immediately after activity to calm down a reactive tendon or nerve. And 6. Heat, which can relax tight muscles and promote blood flow. Until next time, train, climb, send, and repeat.